Do you know the early signs of speech delay in children? Recognizing these signs is crucial as early intervention can significantly enhance outcomes. Speech delays can vary widely among children, but there are common indicators that may suggest a child could benefit from a professional evaluation. From limited babbling to lack of social communication, understanding these signs can be the first step towards supporting your child's speech development. Stay tuned as we delve into 5 common signs that may suggest your child could benefit from a professional evaluation. The first sign to watch out for is limited babbling by the age of 7 to 12 months. Babbling is a critical milestone in a baby's speech and language development. Typically, babies start to babble around 6 months, producing sounds like baba or dada. These delightful sounds are a baby's way of experimenting with tone and rhythm, essentially laying the groundwork for future speech. However, if by 7 to 12 months your child shows little to no babbling or doesn't vary their sounds, it could be a cause for concern. This lack of babbling might indicate a delay in speech development. Remember, each child is unique and develops at their own pace. However, if you're noticing a significant deviation from these general developmental milestones, it's always a good idea to consult with professionals for personalized advice and guidance. Moving on, the second sign revolves around the use of gestures. By 12 months, many babies start to wave, point, and use other gestures to communicate. Gestures play an integral role in early communication, helping little ones express their needs, interests, and emotions. They're like the scaffolding that supports the budding structure of language development. Babies might wave bye-bye, point at a favorite toy, or reach out their arms when they want to be picked up. But what if these gestures are absent or limited? It's important to note that children develop at their own pace, and some might be a bit late to the gesture party. However, if by around 12 months your child isn't using gestures or their use of gestures is minimal, it could suggest difficulties with communication skills. Remember, it's not about comparing your child to others, but rather keeping an eye on their individual progress. If you have concerns, professional advice can provide reassurance and guidance. Next, let's discuss the number of words a child typically knows by the age of 16 to 24 months. By the age of 16 to 24 months, children often have a vocabulary of around 50 words. They start to combine 2 words like more juice. However, if a child's vocabulary is significantly smaller than 50 words by the time they reach 24 months, or if they are not yet forming 2-word phrases, this might be an indicator of a speech delay. Around the same age, children also begin to understand and follow simple directions. For example, if you ask them to bring you a toy, they should be able to comprehend and execute the task. If your child consistently struggles with following such simple instructions, it could be a sign of a speech or language delay. It's important to remember, though, that all children develop at their own pace. These are just general milestones to guide you. Lastly, we will talk about social communication in children. Children typically engage in social communication, including imitating words and actions. This is a fundamental aspect of their development. It's through these interactions that children learn to express themselves, understand others, and form connections. By the age of 24 months, most children show interest in their peers. They start participating in simple games, and their curiosity about the world around them begins to shine through. They mimic words, sounds, and actions they observe, reflecting their growing understanding of social communication. However, if a child shows limited interest in social interaction, has poor eye contact, or doesn't engage in communication games like peekaboo, this could signal a speech delay. It's important not to panic at the first sign of possible delay, but instead, observe and record your child's communication behaviors. Consulting with a pediatrician or a speech-language pathologist can provide a comprehensive evaluation of your child's speech and language skills. Now that we have discussed the 5 signs of speech delay in children, remember that each child is unique and develops at their own pace. In summary, we have discussed 5 signs of potential speech delay in children. From limited babbling and lack of gestures to a limited vocabulary, difficulty following instructions, and lack of social communication. Each child is unique, and variations can be normal, but awareness of these signs is crucial. If you observe any of these signs, don't hesitate to consult with your pediatrician or a speech-language pathologist. Remember, early intervention is key. If you have any concerns about your child's speech and language development, it's always best to consult with professionals for personalized advice and guidance.
Thank you for watching this video.